Hey, soul survivors, I wanted to bring up the complexity of mental health conditions and also the factors that can lead to misdiagnosis. Now, I know a lot of people are kind of diagnosing their person as a narcissist. It could be something else too. So I want to talk about even in the psychiatric professions that they misdiagnose. I know several people who have had misdiagnoses. So there are mental health conditions that often have complex and multifaceted symptomatology. So these symptoms can manifest differently across individuals, making it challenging to create a standardized set of criteria for a diagnosis. There's also co-occurring disorders, which is known as comorbidity. So the presence of multiple mental health conditions in an individual is very common. Identifying and untangling the specific contributions of each condition to the overall symptom picture can be intricate. So diagnostic criteria for mental health disorders are being revised over time. So you even see changes from the DSM-4 to DSM-5. Somewhere around the time I was born, they saw homosexuality as a mental illness, and that is no longer categorized. So that's just one of the changes that we see evolving. So these changes can affect how clinicians categorize and diagnose conditions, potentially leading to shifts in prevalence and diagnosis rates. So sometimes we think something may be a mental disorder, and then over time we might think it's different, or we might rearrange which symptom goes with which mental condition. So you also have clinician bias, and that includes stereotypes or preconceived notions about certain disorders or patient demographics that can influence the diagnostic process. And this can lead to overemphasis or even underemphasis of specific symptoms or conditions. So if I dressed in a sexy dress, they might think I'm histrionic, to where I use my body for attention, but it's like, no, I have a cocktail party later or something. And they stereotype you. Or if you're poor and you just, you're wearing sweats, they could say, well, you just don't have a lot of self-esteem. And you're like, no, I just don't have a lot of money. So in many healthcare settings, time constraints can limit the thoroughness of assessments. Brief appointments might not allow clinicians to explore the full range of symptoms and contextual factors influencing the patient's mental health. Also, lack of collaboration. When it's insufficient among healthcare providers, especially when patients are receiving care from multiple sources, this can lead to fragmented information. And a comprehensive understanding of a patient's history and current state is crucial for an accurate diagnosis. We also need to know, what are some of their habits? Are they addicted to drugs? We have to rule those things out. Alcoholism. And there's also stigma. And when it's surrounding mental health, it can possibly deter individuals from openly discussing their symptoms, leading to incomplete or inaccurate information during assessment. Some individuals may also downplay or deny symptoms due to the fear of judgment. So narcissists, they don't like that judgment. They like to maintain that image. So if they go, they will most likely, plus they're also used to lying, they will most likely keep that facade up. They don't want that diagnosis, or they're going to try to prove you wrong if they end up going and saying that you were wrong, that they're not a narcissist. So they know how to manipulate the system. They know what's right. They know what's wrong. And there's also cultural factors. There's differences in symptom expression and interpretation may contribute to misdiagnoses. Certain symptoms may be perceived and described differently across cultural contexts. And unlike many mental health conditions, many mental health disorders often lack clear and objective biomarkers. So these diagnoses heavily depend on observable behaviors and reported experiences, which can be subjective. And also training disparities, variability in training and expertise among healthcare professionals can contribute to differences in diagnostic accuracy. Specialized training in mental health is crucial for accurate assessments. And, there's also the religious factor. And people's bias on what is healthy, what is not. Some people will think certain things are not a big deal. Others, it could be a great big deal. Also, some people will relate to the depth of the trauma, or some might pass it off as like insufficient or superficial. So when you are dealing with trying to figure out, am I with a narcissist? What matters is how you feel, how it's affecting you. Your body will tell you if you're safe or unsafe. There's a reason you start to feel unsettled. And in a healthy relationship, you can talk through those things like, look, that hurt my feelings, or can you just let me know when you're going to get to a certain place? I just feel more comfortable. And if the person cares about you, and if they're not hiding anything, they usually will do that. But the narcissist loves to use that future faking. They will say whatever it is just to appease you. And it can be quite frustrating, especially when they say that they will do something and then they don't follow through. It leads to anxiety. And all this could be avoided if they would honor what they said to you, honor their commitment. Our bodies start to feel when things are off. And with the different mental illnesses, mental disorders, or struggles that we have, it throws off the balance. And it's real easy getting along when two people are healthy, happy, having fun. And it gets frustrating with the narcissist because they go through that cycle, and it's a constant cycle of abuse that we start to feel like we're in the clear and things are getting better. And then that trauma bond happens where it's that intermittent reinforcement where we have hope, and then we're in despair, and then we have hope. And because of the hope that we've had, and the cycle, it leads us to believe that things will get better. Now, if they're with a new supply, the same thing's going to happen. And I've been reading a lot of different comments, on some of these relationships, on where they're going wrong, what the expectations are. Some people are just wanting to get married. You can see that the person's not ready. You see the other person communicating that they're not ready, but it's like a timeline that they want to stick to, but it's obvious that it's not the right person. So sometimes we have like this fantasy in our head of what things should be. And we have to realize, has our person told us that they're not ready? Has our person told us that they just want to play the field? And are we overlooking certain red flags? But sometimes when you get too far into the relationship, whether you got married or you have children together or you're cohabitating, that it gets tricky. Do you stick it out or do you walk away? And because of the abuse, if it is a narcissistic person or somebody who is unstable, it can start to cause brain damage and physiological responses that can make you quite sick. And it can lead to cancer, heart attack, diabetes, all these kind of things. So it's something to take seriously. And, couples counseling, things like that. But to stay in a relationship that is not going to get better or is going to keep the cycle of abuse. Also, if you're longing for your person to come back, really look at who they were. Were they somebody who followed through for you? Did they keep their promises to you? Were they concerned? Or did they dismiss you? The silent treatment is so toxic. And like you see it all over, how many narcissists use the silent treatment. That is so damaging. That is so dismissive. And sometimes we just want our feelings validated. And, we're even to where it's like, just, do you hear what I'm saying? And we don't even get the opportunity to connect with the person. And so there's this wedge that keeps getting between us. And the more that wedge builds, the harder it is to come back from. The narcissist just wants it easy. The narcissist doesn't want to be concerned at a deep level. So if they go to counseling, it's all for show. It's either to keep you around, but it's not to change. It's not to change. And a lot of times that's when things get even worse, because you're there, like, let's validate each other's feelings, and they tear yours down even more. Or they get the psychologist to be on their side. Narcissists just have a way of presenting things. They've learned this over their lifetime on how to get people to see things their way. And it's so toxic, and it can cause CPTSD, Stockholm syndrome, codependency. I'm not sure if I said CPTSD, but it's real hard to break free. But you deserve to have mental help, peace in your life, and to truly be loved. Somebody who's on your team, not cutting you down. And a lot of times people from the outside don't see what the narcissist is doing to you because it's a facade. It's a mask when they're outside of the home. The person closest is the one that gets hit the hardest with the abuse, or the children of that person. And, if you have children, think about how the toxicity is going to affect them. It could cause them to become narcissists. And then you have this whole family of narcissists. Stay true to yourself. Stay true to your boundaries. And if somebody truly loves you, they will honor your boundaries. Special requests are welcome. Please share it. This will help someone.